Smooth 98.1. It just feels good.
Feed your mind and the rest will follow.
Free your mind!
You start with figuring out, what does health look like for me? Physically, mentally, emotionally, and work really hard on being good at you.
Healthy mind, healthy body, healthy life. Soul Food on Smooth 98.1.
Okay, so we're live. Welcome. It's time for Soul Food here on Smooth 98.1. Love music, love life. We are talking about something in commemoration of the International Men's Day, and it's all about the men's reproductive health or men's sexual health, as the case may be. So if you want to be a part of this conversation, there are 4 ways. 1, you can call 01-448-9981. 2, you can send your WhatsApp messages to 0809-444-0981. 3, you can tweet at us on Twitter at Smooth981FM is the handle, and the hashtag is SoulFood981. And the last one is head over to our YouTube channel, which is youtube.com/Smooth981FM Lagos, and drop your comments right there in the chat box. So those are the ways you can be a part of this conversation. So let's get started. I have my guest joining me via Zoom, and he is one of my favorite consultant urologist who always is there anytime we need him to talk about something relating to these things, and I'm forever grateful. So please make welcome Dr. Chigozie Onyeze. Good morning.
Good morning, Sean. Good morning. Thanks for having me this morning.
Always a pleasure. Thank you for making out time for us. So let's get started now on, now the reason I decided to pick this one, men's sexual health, is going through some studies and some data. I realized that a man's ability to perform sexually, in quote, is somehow tied to his overall confidence and ego, which I find weird. And sometimes I'm even forced to disagree with that partially, because why should that be a sort of marker of his confidence? Why should that contribute to his confidence level or not? That's one part of it. The second part is when you go around, be it in all these roadside sellers and dealers in drugs, you tend to see, if you see 10 sexual enhancement pills, 9 of them will be for males, if not all of them. And I'm thinking, what is the issue? The pressure is so much on the man to perform. So that's one of the reasons I am talking about this. So over to you, Dr. Chigozie.
Yeah, thanks, Sean. Well, thanks once again for having me. I'm not sure I'm going to put it. I don't think that the pressure is just on the man, but it's because of the cultural thing. People believe that the man is key to, or the man is the one who is supposed to drive sexual function in the house. So if things are not going well sexually, it is obviously the man that is responsible. Sex is something that is key to family life, key to adulthood, key to, you can't talk about parenting without starting from having sexual intercourse adequate, then going to reproduction and stuff like that. So particularly in our culture, the Nigerian culture, it is something that is key. It might not be spoken out so much, but it's, like you said, a cause of frustration. And it's not just something that started recently. I think it's something that it dates back to long ago. For those of us who are Christians, I think one of the first things that God said to Adam and Eve was, be fruitful and multiply, replenish the earth. You understand? So, somebody just wakes up and the first instruction that he gets is be fruitful and multiply. And some people feel that that's their mandate in life. So if you're not doing that, you're going to feel bad some ways. And sometimes between the man and the woman, if the man is not having adequate erection, then the woman says he's not a man. People attach being able to do well sexually to being a man. I don't think that's the truth really, but that's the myth. That's what is believed generally. So you see why people put a lot of emphasis on being able to achieve and maintain good erection. So I would also say that sex is important to the male existence. You can't procreate. You can't, particularly in an environment where people want to have children, offspring that would carry on family name. If you're not performing well sexually, you will not be able to perhaps fulfill that obligation. And it's also important I mentioned the fact that sex is not just for pleasure. Well, people say it's both for pleasure and for procreation. So we have people who wouldn't touch their wives except they want to have children. So that's also not good. And I was in a meeting somewhere, one of these rural meetings somewhere in Enugu State at the time, and we had this woman with 11 children. Is it 11 children that came for the meeting? And, meeting of doctors, and it was like a health stuff we're doing that morning. And we're like, how do you have 11? She said, that she has not finished though. That her husband says she must deliver all the children that is inside her. That's everything that God has given to her. They must bring it out. They are not going to leave. So I was wondering, this woman with plenty of children. So you see that we have two extremes, and we need to strike a balance and all that. The ability to maintain or to achieve and maintain or sustain adequate erection is central or is key to a whole lot of these things. There are different types of erection. It's natural. People start having erection from maybe when they were children. You wake up in the morning and it's early morning erection. It's normal. It's something that is physiologic. It's something that is part of life. People also have erection while asleep. We would call that nocturnal erection. So it's part of what I would say is part of a kind of sleep. I'm not sure how to explain it. It's a REM sleep, rapid eye movement sleep. It's a phase of sleep that happens when people are asleep, and it comes with erection. Then we also have psychogenic erection, sometimes by the things you see, audio visual stimulation and all that. Somebody who is beautiful is passing by and somehow you develop or you get an erection and stuff like that. That's psychogenic. Then we also have things like tactile stimulus and all that. These are things that would be able to cause erection in people. Now, part of what I want to discuss is abnormality. We know that erection is normal, and people don't come to the hospital when they have normal erection. People come to the hospital, or people seek medical care when the erection is not there. And somebody would perhaps say, so what is erectile dysfunction? It is the persistent or the continuous inability to either achieve or sustain erectile dysfunction for a satisfactory sexual intercourse. I chose my words carefully because sometimes people are not able to have or achieve or maintain sexual intercourse, but that's just temporary. So, but when this becomes permanent, when this becomes recurrent, when this becomes something that happens from day to day, then it becomes a problem. If you take a sample of married men, and say, out of 10 times, how many times do you actually achieve and maintain erection? Probably maybe 7 or 8 times. There might be just this 1 or 2 times or 3 times that things didn't go well as planned and you just slip off and stuff like that. Okay, but if it now becomes something that is recurrent, sometimes we even give a timeline, maybe up to 6 months, then we say that that's erectile dysfunction. And it is something that people should actually take cognizance of, and then maybe it's something that people should actually address. It is not only a medical issue, particularly like I said in our culture, it's also a social issue. It's a cause of infidelity. A woman is not satisfied at home, and that is a cause why she would want to look for either younger people that perhaps will be able to satisfy her. Something to also mention is the fact that the severity and the incidence of erectile dysfunction increases with age. While I was preparing for this meeting, I was just thinking, some people who are younger do not have money. They are still hustling, okay? And they still have their erection. And they want to postpone their satisfaction to when they are older, when they have money. And then when you have money, the erection is gone. So it's just to strike that balance. It's not exactly an easy thing. It's a cause of low self-esteem. Okay, some people feel very bad because they are not able to. I've seen couples who come to see me, okay, while I was running clinic in Lagos. I've seen couples who come to see me and who would say, well, they'll come for 2 things. One will be for reproduction, but behind the thing, the complaint will be that, oh, we don't have kids and all that. But behind the thing, the man is not also firing very well. And that's also something that they would have to work on, and sometimes would have to do this. It's not just for younger people, even older people, particularly older people are involved in this. And there are different components to these things. Sometimes it starts with what we call loss of libido. I mean, the guy is not even interested. I've had couples who come to see me for other things, and then maybe they come with their wives, and the woman is saying, my husband is not even interested. He doesn't look at me. I've seen that. I've heard that complaint several times. Ladies who perhaps, and sometimes they perhaps wouldn't say it when their husband is around. They'll say, doctor, please, when he comes, can you tell him? I mean, he doesn't even touch me at all. How can you look at me and you're not touching me? And so the man has lost his libido. I'll talk about the causes because these things sometimes can be hormonal. It can be a decrease in the level of testosterone in the man. So that's one of the things. So when you don't even have...
Sir, apology for interrupting you. We need to take a quick break. When we come back, we'll come back to you.
Okay, no problem.
Thank you so much. And now, if you're joining us for the first time, you're listening to Soul Food here on Smooth 98.1. And this is a segment where we talk about health and wellness. But in commemoration of International Men's Day this morning, we are talking about men's sexual health and their reproductive health generally. So you can be a part of it by sending your questions to 0809 444 0981.
They call me M.I. Mr. Incredible, short black boy, the champ.
Okay, I was already lost that I lost track of time. Oh wow, there is a lot involved. We'll just try the one that we can. And so when we come back, you continue, right? And then we talk about the
I'll try and make it brief. I need to get to the treatment part and what people need to do. But I have to give the background about what the causes are. And
it's
then
very important, yes.
To defeat November 2022 at the main bowl, testing the logo stadium.
Someone just sent me a message. Is it morning erection or money erection?
Oh, that was a good one. True. Oh, okay. Well, that's part of the things that comes with being a man. It's like money is
key.
It's key.
You have money. You know have the morale.
No morale. Man, being a man indeed, it's not a day's job.
Experts for optimal well-being.
How to prevent it, detect or treat it.
Tune in every Thursday at 5:15 p.m. on the Smooth Drive.
So Lagos, if you didn't know, now you know.
Smooth.
Smoother than a fresh jar of secrets.
And we're inviting you to join the Smooth family. This is Smooth 98.1. We are talking about reproductive health, the do's and don'ts for the men, and Dr. Chigozie Onyeze is laying the background very, very well and explaining some things that cause erectile dysfunction, different types of erection, and how we're about to delve into the causes and also what you can do to fix the situation. You can be a part of it by sending your messages and questions to 0809 444 0981. We do not have so much time. This segment ends at 8:30. So the earlier your questions come in, the better. So over to you, Dr. Chigozie.
Well, thank you very much, Sharon. So as I was saying earlier, some people, it's loss of libido. They don't even have any desire for sexual intercourse. Some other people, they have desire for sexual intercourse, but they are not able to initiate sexual intercourse. Some people can initiate it. They can initiate erection, but they're not able to sustain it. And that's probably the more common complaint. Some people ejaculate just before penetration, and that's really, really psychologically demoralizing. And then we have this small group of people who cannot ejaculate. So it's a problem for them too. It can be anejaculation, it can be retrograde ejaculation. I mean, these are some of the problems that people have. It is when we interact with these guys that we're able to tell what spectrum they belong to. Let me go very quickly to some of the causes. Many of the causes of erectile dysfunction are broadly classified into two. We have psychogenic and we have organic. I mean, psychogenic is a situational thing. Psychogenic is because of the person's psyche, because of the situations around the person. I mean, loss of job, poor economic situation, the guy is broke, and things like that, frustration, depression. Sometimes it's related to someone's partner. I mean, you see people who have more than one partners. With one partner, they are able to have erection. With some other partners, they are not able to have erection. So we call that sometimes partner dependent, erectile dysfunction and things like that. And then we now have the guys who properly have an organic problem, like a treatable problem, a sickness, like you would call it. And sometimes it might be from the nervous system. Of course, sexual stimulation is transmitted via nervous transmission and stuff like that. So if there's a problem, CNS problem, that could lead to that. Sometimes it can be endocrine, hormonal problem. The guy is having probably a decrease in the level of testosterone, which comes with age sometimes. Sometimes the guy has some other condition, maybe some issues with what we call prolactin. These are things that perhaps could affect. And then we have this other group of people who are on some medications, okay, medications for other things. Some people have antihypertensive. I mean, I remember running an outreach somewhere in the southwestern part. I think it was in Ijebu many years ago. And I have this guy who came in, he was hypertensive. And what he now said to me after, the hypertension is just the normal thing he came to complain where everybody's listening. Then when he after, they said, but doc, please, this thing is not working well. And I said, what drug are you taking? He now mentioned some of the drug he's taking. I said, this is the one that is causing your problem. And I said, that's true. It is since the day the doctor gave him this one that he discovered that the thing is no longer working well. So sometimes it might be some of the drug, some antihypertensive drug, antidepressants, even anti-ulcer drugs, as simple as, I won't want to mention names and all that, so I don't spoil market for some of these drug companies. But some anti-ulcer drugs and stuff like that are things that can cause. So the issue is, what do we expect people to do generally when they have this kind of stuff? Number one is to see whether you can reassess the situation and be sure whether you're not having a very high expectation. We have people who have sexual intercourse for maybe 5 minutes, and because they saw on Instagram that somebody is doing for 2 hours, they want to think that they can do 2 hours. It's not, I mean, you have to set something that is realistic for yourself. So if I'll start with the treatments or what people should do, number one would be lifestyle modification, regular exercise. Sexual intercourse can be akin to saying sports. I did my youth service with the police, and I remember one of the DPOs at the time would tell me, doctor, is it badminton or is it bedminton? Okay, so it's a kind of sports for him, so sexual intercourse. So if you're able to have regular exercise, you're able to run, you're able to improve your cardiovascular status, perhaps you may be able to use that same strength when you're having sexual intercourse. You won't be lazy on bed. That's one of the things. Number two is weight loss. There's a relationship between obesity and what's it called, and erectile dysfunction. If people can shed some weight, I won't go into the details of all the pathways where fat is metabolized and how it affects the imbalance between testosterone and estrogen and stuff like that. That's not necessary for this discussion, but it's one of the things that people should do. If you can shed some weight as a man, it perhaps will be able to improve sexual performance and all that. The other things we want to talk about is eating balanced diet. Now, balanced diet is key. Some people just eat fatty foods. I mean, you eat, everything is fried, you fry this, you fry that. And these things have the way of distorting the, what we'll call lipid status of the person. Some people call it cholesterol. That's all they know. But there are different things that are involved, HDL, LDL, and stuff like that. I mean, but just know that there could be abnormal lipid profile for these guys. And some of these things can plug the small blood vessels. The vessels supplying the penis and that are involved in erection are very tiny vessels. And if somebody has all those fatty things, it can plug these vessels. And that's why some of my friends who believe that erectile dysfunction can be a prelude to cardiovascular disease. Because if it starts affecting the small vessels, most likely it's going to affect the big vessels of the heart. So these are some of the things that people should have. Now, things like alcohol intake. I mean, some people just go taking binge of alcohol, it's like a regular pattern. You're not going to, we've talked about sensation, tactile stimulus, neuronal stimulus, and things like that. If you take so much of these things, it will impair the afferent, it will impair the judgment. So you feel high, but you won't perform so much because of its effect. Things like tobacco. Okay, it also affects these small blood vessels that supply it. You mean somebody has been a smoker for probably 20 years, 30 years, he's not going to have so much of erection because all those tiny blood vessels have been plugged by the side effects of some of the things they are taking. So these are some of the things, and we encourage people to take things like fruits and vegetables because they have antioxidant effects. They can nourish the body, So these are general things that people can do. Now, if you now come to specifics, one of the things, like I said, that causes erectile dysfunction is psychogenic. So that's a broad class. And then if you can have a supportive partner that tells you, don't worry, if you don't get it this time, we'll get it next time. Or call me, Olowo me, you know, this kind of thing that will make the guy's head, will make the guy relax, rub hand on his back and things like that. The guy will feel more relaxed and perhaps he can do better. But when you say you abuse the guy, you are not even doing well. This other person did this, the guy will feel bad. The guy will sink further. And what you find out is that these guys will begin to come late. I mean, you see guys who will finish from work and they will not go home. They'll probably stay out. They're trying to avoid. Even when they are home, they'll go to bed early before their spouse and all that. So going to bed early might be because he's avoiding something. So it's either he's coming back late or he's going to bed early and things like that. So we need psychotherapy. We need people to encourage them. We need people to talk to them. You need people to be relaxed. Your spouse is not running. If it's your wife, it's your wife. It's not running anywhere. So just calm down. If you don't get it today, perhaps you get it tomorrow. You know, you can, and then people have to generally know what they could do to stimulate themselves. Different people have different thresholds for different stimulus. So if you're not getting stimulated by A, you could get stimulated by B, and perhaps that can be the game changer. I mean, we're not talking of drugs now. These are just the general things that people should do. Counseling, you know, sexual therapy. These are things that people could do generally. And then sometimes there's, for people who are perhaps having problems with ejaculating very fast, sometimes even being able to have what we call pelvic floor exercise. I think we talked about it the last time when we had this talk on incontinence. Yeah. Help the pelvic floor and help the guy withstand stuff. For people perhaps who are having, maybe they are not able to sustain erection, they could interrupt erection when they feel that they want to ejaculate. They could actually just stop, take a break, allow the whole pressure to just go off, and then perhaps they could resume later. So these are some of the general things that people could do. Now, medically, it is advised that if you're having problems, you should see a doctor. That's the first thing. If you've done all this general stuff, don't go and start taking different types of agbo. And by the way, while I was living somewhere, one part of the Lagos, you see that certain suya points, you have a whole lot of people going to those suya points, because I don't know what those guys put into their suya, but the guys have known that if you go to this man at this junction and you perform well. But if you go to this other person, perhaps because some of those guys add some additives that are aphrodisiac. It's something that people should shy away from. You don't know the dose, you don't know what it is that they are putting, you don't even know whether those things are going to interact with some of the other drugs that you're taking. So people should try and stay away from some of those things. That's a general note. If you see a doctor, he will take specific history from you and maybe give you things that are specific for you. Okay, so these are some of the things that people could do. The things that we do as medical doctors perhaps would be things like maybe stopping all medications, like I did for the man I told you somewhere in Ijebode. We just stopped all the medications that perhaps could cause it. If it's something that is very pressing that we can't stop, then we could switch to an alternative that would have less side effects. And then sometimes we have to run hormonal profile for people to be sure that their testosterone level is fine. So if it is fine, good. If it's not fine, we'll decide whether or not that person could be supplemented, with some of hormone supplementation. We will not want to do that if somebody is at risk of prostate cancer. Obviously, while talking now, some people say, "Oh, doctor has mentioned testosterone, so they'll go and start getting testosterone." If you are 60 and above and you are treated for prostate cancer and you take testosterone, Oyo is your name. you're just on your own. Okay, so you should not do that. You should make sure you see a doctor. Things like there are some other medications we give, we call them phosphodiesterase inhibitors. That's where the aphrodisiac now comes in. Okay, those drugs, they are different brands, different. I'm not going to start, I'm sure some people have biro and paper, they are waiting for doctor to mention one drug so that they'll start abusing it. I'm not going to mention anything. Okay, but the general class is phosphodiesterase inhibitors. And these medications are medications that perhaps will be able to cause some vasodilatation of the penis and all that, and cause increased blood flow and good erection. Now, some of those drugs have side effects, things like nasal congestion, things like perhaps headaches. You see people with a very uncontrolled blood pressure, they should not take some of this medication. That's why it's good to see. Have you seen in the news where people say they're having sex romp in the hotel and somebody collapses? It's because the man is he's gathered both the native one and the one he got over the counter in the chemist and things like that, and he's just messing around. So I think that people should see their doctor, and maybe the person who they are seeing can prescribe things that are unique or individualized for them. Some of the medications I've talked about are things you can give orally. They are the oral drugs. There are those that are injectable. While I was working in Lut, we used to call it expensive drug for expensive sex. I mean, way back, probably around maybe 2019 or thereabouts, some of the drug cost as much as 45 to 60,000 naira, and that's just for one sexual intercourse. You just inject it into the penis and it will cause erection and all that. So I'm wondering if somebody that is earning minimum wage would have to work 2 months to be able to afford one injection to have just one sexual intercourse. You see that? So those who have very good erection should go and do Thanksgiving somewhere, either in church or fellowship, and thank God that they're having good erection. So there are some other things that we do that we instill into the urethra. Okay.
Okay, yes, sorry. Just before you fire on, I just need to take this quick break. I'm sorry for interrupting the flow. And if you're joining us for the first time, a whole lot has gone out. Virtue has been dispersed, but you're welcome to join. We have about 5 minutes more after this break. Just stay right with us. This is Smooth 98.1.
Are your number one.
That time is really short.
I'm trying to run, but I'll see how much I can do.
Yeah, I know. I can catch the I can catch the pace.
This is Johnny Trip.
Oh my days. Wow. Injection.
What does
yes
banking mean?
We used to, I won't mention names, so I won't spoil brand for people, but I mean,
or just simply
I don't know with the price of with the exchange rates, I'm not sure how much those things will cost, but I mean, if it was costing around 45k to 60k at the time, you can imagine how much it will cost now.
Take care of your daily experiences at Providence
really
Bank.
We believe that
banking should be all about you and your business and how to get you to the next level. If you do not already have a Providence Bank account, please speak with our business concierge on 0700 77 684 387 or email businessconcierge@providencebank.com to switch to a future forward banking experience. Providence Bank, future forward banking.
Hi, my name is Richard Muffelamiju. I love Smooth 98.1 because they play my kind of music. Love music, love life. Smooth 98.1.
It's Soul Food here on Smooth 98.1. Love music, love life. If you're joining us for the first time, we are talking about health and wellness. That's what we usually do here. And this morning, it is 19th of November, 2022. It is the International Men's Day, and we are focusing on men's sexual health. If you're just joining us, you have missed out a whole lot, but do not worry. The video is up on YouTube for you. You can quickly join the live stream, and then we have 2 minutes to ask questions. So you can quickly send your questions to 0809 444 0981 is the WhatsApp line, 0809 444 0981, or quickly call 01 448 9981. I really hope we're able to take that because we need Dr. Chigozie to still drop some gems. So over to you.
Well, thank you very much, Joe. So I've been able to talk about some of the things that people could do as per lifestyle modification and what people could do in terms of seeing their doctor, the kind of medication that the doctor can prescribe. But sometimes even all these things fail. I know people who have switched from one PD5 inhibitor to the other, and it's not working. It's not working. Suffice it to say that some of these drugs require you must have an intact neuronal system for some of these drugs to work. While I was in Ife, there were this medication or this stuff we used to do for some of our patients, and that's vacuum pump. We help some of our patients get vacuum pump. So getting erection is by inflow of blood into the penis, but sometimes the blood disappears back into the body, okay, or back into the circulatory system, so it's not able to stay long. So we have these guys who have some kind of problems, and what we'll do after giving all these drugs and they're not working is to get the next line, which is to get vacuum pump, and we used to help them order for some of these things from abroad at the time and demonstrate. We have a couple of them that we had to demonstrate in clinic for them. Then the top line, or the next phase, or where the world is as per advancement, is to have a penile implant. You'll be surprised. People
there is that
breast implant, butt implant, and all that. We also have penile implants and all that. So we have the malleable ones, and we have the ones that are inflatable. Okay, so that's reserved as that's the last point when every other thing has failed. So that's why it's important for people to see their doctors and all that. I want to say some things, because I know there are some people who have been abusing drugs. Just in my place of work here, I've had to see the same person, young guy, probably 22, coming. He comes when I'm on call. I don't know how that happens, but he comes to this persistent erection. And sometimes it's from abuse of substance. So when erection, we are talking about loss of erection or erectile dysfunction, but when erection becomes longer than 4 hours, it's problem. It's a medical emergency or surgical emergency. That's called priapism. So I've had, while I was in Lagos, I had these guys who perhaps will come with priapism, and I have to sort them out. So it's important for people not to abuse this drug so that they don't go from erectile dysfunction to what we call priapism. That is a sustained painful penile erection that is not even relieved by ejaculation or sexual intercourse. So, and that can cause damage. It's like overheating of a car. Overheating of a car can damage the gasket of the engine. So that's the same way. If your penis overheats, it can damage the very tissues and all that, cause fibrosis and stuff like that. That's one. Another thing is, sometimes in a bid to perform, people fracture their penis. I'm not sure whether you're aware, or we have what we call penile fracture. Pop, the penis breaks. I've had to repair a couple, both when I was in Ife and when I was in Lagos. Penile fracture. We're having World Cup now. I think the last time, I'm not sure whether that was the last time, but there was a World Cup when Nigeria played Iceland. I think, I'm not sure which World Cup. The years are just flying. But there was a day, I remember it was Nigeria versus Iceland, and we won the match. And somebody who had taken so much to celebrate and was firing, broke his penis and broke his urethra. We had to repair that. Maybe 4 years ago. I think it should be 4 years ago or 8 years ago. I'm not sure. But it was during a World Cup period. So it is something that people should watch out for, so that they don't abuse things and end up on the surgical table. Time, sure, but there's still a lot to talk about.
We're actually out of time, so out of time, and that's sad. We can't even take messages and calls because we're out of time. But thank you so much for all the information. At least one thing I am taking out is that no part is isolated, no part of the health. Your sexual health is still a part of your overall health. So all the foods you eat will still tell, and the exercises you do or you do not do. So the information has already been given to you so that you can fix it and address the situation. And I'm surprised we have such a thing as penile fracture. I had no idea.
Yeah. The way, I mean, you think it's only bones that can break.
Yeah.
Actually, when the penis is erect and turgid, it could be as strong as that. And if one hits the penis on the bone and all that, sometimes awkward sexual positions and things like that could actually have penile fracture. I've repaired a few while I was in Lagos, and well, they had good outcomes, but people shouldn't go fracturing their penis. Just take life. Jejelaye, take life.
Half a word is enough for the wise. Please take care of yourself and do not do past yourself. That is that's putting it in English now. You know, do not do past yourself. All right. Thank you so much, Dr. Chigozie. If people want to reach out to you or ask you further information, how can they do that? We keep going over this.
We have talked about this several times. I'm not a social media doctor.
Okay. All right, then. Still, there should be a way around it. Well, we would look for a way around it.
Don't worry.
But thank you again.
Thank you very much. Thank you. All right. Thanks for having me.
Always a pleasure.
All right.
Enjoy your day and work too.
Yeah. Thank you. Thank you. Bye.
Bye. And that's all we can take this morning on Soul Food. Thank you so much for being there and listening. I see the messages on YouTube. You can still share this on YouTube with someone who has not gotten the information and someone who needs to be enlightened. So go to our YouTube channel. It is youtube.com/smooth91 FM Lagos. In 5 minutes time, it will be time for the kids, and the show is called Curious Minds.
Mind and the rest will follow.
You start with figuring out what
Thank you so much, YouTube. Thank you, everybody.
Mentally,